And while that's fine, and a lot of people feel better taking a nutraceutical treatment, it's important to understand the evidence behind those things. So saw palmetto is the most common supplement, that's quote unquote recommended for an enlarged prostate. But in a randomized placebo-controlled trial that was published in JAMA over 10 years ago now, it showed that there was zero difference in urinary symptoms between saw palmetto and placebo. And in this graph here, I'm showing the placebo and saw palmetto, and you might not even be able to see the two lines there because they're exactly the same. In addition, there was no more improvement in other endpoints with saw palmetto versus placebo, but there were no side effects either. So my general advice is if you feel it's helping you, that's okay, but it's important to understand the evidence showing that versus a placebo or a sugar pill, really no difference. In contrast, we have multiple large, well-designed clinical trials showing that various medications are helpful in improving urinary symptoms and also decreasing what we call progression in BPH, getting to the point where you can't empty your bladder, you need surgery, or you need a catheter. And those are those medicines I mentioned before. They're what are called alpha blockers. And what those do is they relax that channel in the middle of the prostate. It's very analogous to us doing surgery on the prostate to open up that channel, but it just medically relaxes that channel. Those are called things like tamsulosin, alfuzosin, silodosin, doxazosin. Then there are medicines called 5-alpha reductase inhibitors. And those are medications like finasteride and dutasteride. You may notice finasteride because that's also a medicine that's used for hair loss in men. At a 1 milligram dose, finasteride is Propecia, or is used to reduce hair loss. But at the 5 milligram dose, we use it to shrink the prostate. What those medicines do is they stop the conversion of testosterone to what's called DHT, dihydrotestosterone, inside the prostate.